Okay. Um, I think that, probably the biggest issue people have with Obamacare is that they view it as an entitlement. There are a lot of folks that are out there working hard, paying their taxes, and they hear about these government subsidies, and they say, oh my God, I am going to be now required to pay for my health insurance, plus I'm going to be paying so much money to cover, Joe or Sally's health insurance down the street also. Um, and I think they're not looking at the savings that can come through the system from outcome-based pricing. They completely discount that. They're also, as you pointed out a couple of minutes ago, they're discounting the fact that the government has long required the existing healthcare system to provide care in the emergency room, which is the most expensive point in the system. If people that were going to the emergency room for care today had access to a physician and they could get problems diagnosed and treated before they became emergencies, we could treat that illness at a much lower cost. So it really is a big change in the healthcare system, and I think there's a lot of concern out there, and I understand. There's a lot of concern that will not be as efficient as the proponents of Obamacare advertise or hope that it will be, and I think that's a valid concern. The second thing is that there is a little bit of cost shifting going on between demographic groups. The implementers of Obamacare, as they set down the rules for the insurance industry, they set sort of a cap for people that are pre-Medicare, let's say from age 50 up until 65, that the monthly insurance rate for those people would be capped at something like 3 times the rate of a 20-year-old. Based on their natural illness rate, that rate probably should be a little bit higher. And so those people in kind of the middle age group, running say 35 to 50, probably not so much change. Maybe their rate is a little bit higher to pay for those that are say 50 to 65. And then those people who are 20 to 35 in the youngest, healthiest age group, probably they could go out on the private market and acquire a health insurance policy for maybe $100 a month previously. I think the rates on the Obamacare exchanges for healthy 20-year-olds might run, say, $200 a month if you don't qualify for any subsidy. And so that looks a little bit higher. Some of these people may in fact qualify for a subsidy, and they may not pay any more than $100 a month. But there is a little bit of cost shifting, and so the 20-year-olds are going to complain and say, well, look, I had a policy for $100 a month, now I'm under Obamacare, and you're telling me I have to pay $200 a month, and I really don't like that. The thing about 20-year-olds is if they're lucky and they live long enough, they will become a 55-year-old. And at that point, their rate would be no more than, say, 3 times a 20-year-old. And so you pay a little bit more up front. Unfortunately, you have to wait a long time to get to where you collect the benefit. But for myself, being in that older age group, I know if you wait around long enough, it does get here. The last thing I'll talk about is the website, and I really don't want to say too much about it. It's poor. It doesn't work. It doesn't respond quickly enough. Not enough people have been able to get through it, but the website is just the portal to apply for an insurance policy. It has almost nothing to do with the parameters of how the health insurance system is actually going to operate. It'll either be fixed in a timely manner or it will not, but the website is not Obamacare.
Both of us have worked in the IT world for a long, long time, over 40 years, maybe 80 years experience between the two of us. And no website or no program that we've run into working for IBM, BMC, some of the largest companies in the world, actually worked or supported this many people in this complex an issue. So yes, it's poor. It's set up and designed by the lowest paid contractor, which is the way contracting works. So there we should assume there are going to be problems, and there are also too many people going out there just to look and clogging up the stuff. Some people, like they did in the 2012 election, to where people went out there and voted for Hillary Clinton because they didn't want Obama to be elected on or winning the primary on the Democratic side. So guys, we know you did that. I have a bunch of friends that are on the right wing that did that. So I also know there's a lot of people on both sides that were curious and went to the website. So the problems are expected. So that's, I mean, we're not trying to defend it. President Obama himself doesn't really defend it. All we want to say is just be realistic. It's going to work. It's going to take a little bit of time, and they'll get it figured out.
All right. So now we're in the summary phase here on Obamacare. We've talked about what it is and some of the major benefits, some of the problems in the old system. The bottom line on all this is it's still a private health insurance run system. These private health insurance companies are in business to make a profit, and it is not the British system. It's not the Canadian single-payer type system. So it still strongly resembles the old system. There are just a few additional rules for the insurance companies to correct some of the egregious abuses that used to occur. So that's the good news is that the major problems in the old system are addressed. So if you're 50 plus years old, you have a serious illness or accident, you can't work anymore, you get laid off, and you have to go and seek a health insurance policy in the private marketplace, you cannot be refused because you have a pre-existing condition. And that's a huge benefit.
Well, what about the comments that we hear that if not enough younger people or the well people apply, that the system will die? Any comments on that?
Well, I think that's true. In order for the insurance companies to deal with a must-insure provision, they must ensure that they get an influx of healthy people, and that's why the individual mandate goes along. You cannot correct the problem of denying people for pre-existing conditions without requiring the healthy people to carry health insurance. Otherwise, the premiums would skyrocket. Essentially, you'd have only sick people in the system. If you could wait until 2 days before your heart attack and go and get health insurance, or the day after your heart attack, go get health insurance and pay $500 a month and get $50,000 worth of benefits, that's just not a viable system. So in order to cover that, I think you do have to have the individual mandate in there, and you have to have large numbers of healthy people paying premiums. The concern over, me paying for somebody else's subsidy so that they can afford health insurance. We've spoken in the podcast about how we paid for indigent care anyhow. They went to the emergency room, they couldn't pay their bill, and basically the hospital passed that along in the form of higher room rates and procedure rates to the health insurance company. That came to us in the form of higher monthly premiums to pay for the people that were not paying anyhow, but we were paying for them at the highest rate in the emergency room, the highest cost of care point in the system. So hopefully that's an improvement. And I think the concern that everybody has, we have a very large, complex system, and we're making big changes throughout that system all at the same time. We would probably all feel a little bit more comfortable if we could go a little slower and change this part this year and see how that works and change another part next year, but that's just not the way it is. So we're going to change a lot of large, important parts of a large, complex system and people are just, I think, very concerned over the question: is this going to work? When I look at the system, I understand the changes that we're making and why we're making them. My take on it is it should work. It takes some faith to kind of believe that all the changes that we're going to make together will work out in the long run. I suspect there are going to be some glitches in the system, some unintended consequences. Anytime you change a system that is this large, this complex, and you drive the magnitude of change that we're driving into it, people will behave in ways that we didn't expect them to. And there are going to be some unintended consequences, and there'll probably have to be some follow-up legislation passed to deal with the unintended consequences over the next couple of years.
You know, being in the IT industry for as long as we have, we used to have a saying that says, if you try to make any software, any computer system foolproof, the fools will find a way to break it. So this is kind of going the same way to where there are going to be new scammers. Hopefully it'll limit the older scammers and get rid of them, and maybe some newer ones will come in, and hopefully we can keep them from coming. What we've tried to do in these two podcasts is kind of give you general ideas about how the insurance companies work and how Obamacare is. We're not motivated. We have no skin in the game. Being centrist, we're trying to present a balanced view. We're not entertainers like the people that you hear on morning shows and DJs and Dean and Raj and those kinds of guys. And like I've said before, we challenge any and all comers to come debate with us in an open, rational format, and so we can get the facts out. What we're trying to do is get America informed. Please visit us at juststreetsense.com. There are no ads currently. We may run them someday, but none whatsoever. The Centrist Foundation is paying for all that to make sure that we stay free of any lobbying. We stay free of any influence. Again, just Google Just Street Sense, and you'll find us. If you don't remember, juststreetsense.com. You can look for Centrist Foundation. We don't have a website on that too full of information yet. When we want to stay in the background, juststreetsense.com is our mouthpiece, so to speak, to where we put stuff up. We are looking for content providers. We are looking for writers. We are looking for people to create content that's balanced and factual, and so we can post it out there and promote it. So please visit us and write us good feedback. And I've seen the feedback on YouTube on many things, even some simple songs to where it gets flaming. Please let's not do that. Please stay factual. Please stay to the point. And you can write to us as moderator at juststreetsense.com, and we will take and try to answer any and all comers. Thank you. Have a great day.